For prevention and control of Ebola, following issues need consideration. Killing reservoir bats. The disease can be transmitted through different ways. Vaccine was not available during last huge outbreak. Ebola patient was not detected in Bangladesh. False answers. The disease was first detected in 2014. Diarrheal disorder is a public health problem with following facts. Giardiasis in children cannot cause shunting. Entamoeba histolytica needs development in soil. ETEC causes diarrhea mainly in children. Vaccine was found to be effective against cholera. False answer. Cholera is not found nowadays in and around Dhaka city. The following diseases are not transmitted orofically: enteric fever, giardiasis, hookworm infestation, entamoebiasis. False answer. Hepatitis due to hepatitis B virus. Disease eradicated from Bangladesh are variola disease. False answer. Poliomyelitis, rabies, leprosy, elephantiasis. Disease eradicated from Bangladesh are variola disease. False answer. Poliomyelitis, rabies, leprosy, elephantiasis. Variola causes smallpox. Why a smallpox eradication is possible? No known animal reservoir, no long-term carrier, lifelong immunity, easily recognition of the disease, subclinical infection does not transmit, available stable vaccine, international cooperation. The microorganism causing congenital malformation are rubella virus, Toxoplasma gondii, HIV, hepatitis B virus. False answer. Mycobacterium tuberculosis. Congenital infections of neonates: toxoplasmosis, rubella, cytomegalovirus, human herpes virus 1 or 2, human alpha herpes virus 1 or 2, human beta herpes virus, syphilis, Zika, HIV, varicella. টর্চ দিয়ে মনে রাখা যায়। ম্যালেরিয়া ইন বাংলাদেশ ইজ এ ভেক্টর বর্ন ডিজিজ, এ প্যারাসাইটিক ডিজিজ। ফলস অ্যান্সার। অ্যান এপিডেমিক ডিজিজ, অ্যান এন্ডেমিক ডিজিজ, এ জোনোটিক ডিজিজ। Examples of killed vaccine are hepatitis B, cholera, typhoid. False answer. Oral polio, BCG. Killed vaccine: hepatitis A, B, Haemophilus influenza B, meningococcal A and B, Japanese encephalitis, rabies, cholera, plague, Yersinia pestis, rickettsia, Streptococcus pneumoniae, Neisseria meningitidis, Salmonella, Bacillus anthracis, pertussis. The parasite enters the host by penetration through skin. Ankylostoma duodenale, Necator americanus. False answer. Ascaris lumbricoides, Trichuris trichuria, Enterobius vermicularis. Parasite enter the body through skin. Ankylostoma duodenale, Niceter americanus, Strongyloides stercularis, larva migraine, Schistosomes S. hematobium, S. mansoni, S. japonicum. A mother in HBsAg positive. A mother is HBsAg positive at 32 weeks of pregnancy. What should be given to the newborn to prevent neonatal infection? Hepatitis B vaccine, immunoglobulin. False answers: immunoglobulin followed by vaccine 1 month later, immunoglobulin followed by phototherapy, vaccine to mother and immunoglobulin to newborn. Details: hepatitis B immunoglobulin it is used for acutely exposed individuals to HBsAg positive blood. Example: doctor, nurse, laboratory workers, newborn infant of carrier months and sexual contacts with acute hepatitis B patient. It should be given ideally within 6 hours and not less than 48 hours after testing of victim's blood for HBsAg. If negative, vaccination should be started immediately and a full course given. If positive, no vaccination. If positive for HBsAg, no vaccination. Dose 0.5 to 0.7 ml per kg body weight. HBIG is given for immediate protection for which lasts for about 3 months. Help link: active passive immunization should be given. Rabies, hepatitis B virus, tetanus. Exotoxin producing bacteria are Vibrio cholera, enterotoxigenic E. coli, Corynebacterium diphtheriae. False answer: Klebsiella, Mycobacterium tuberculosis. Exotoxin producing organisms: Staphylococcus aureus, Streptococcus pyogenes, C. diphtheriae, Clostridium tetani, Cl. welchi, Bacillus anthracis, E. coli, Vibrio cholera, Shigella, Bordetella pertussis, H. influenza. Epidemiological basis for eradication of smallpox where no known extra human reservoir, no long-term carrier of virus, lifelong immunity after recovery from the disease. False answer: active surveillance, elimination of source of reservoir. Details: smallpox is the only disease that has been eradicated from the face of the world of Bangladesh. The following epidemiological factors lead to eradication of smallpox: no known animal reservoir, no long-term carrier of the virus, lifelong immunity after recovery from the disease. The detection of the cases comparatively simple because the rash was so characteristic. And occurred in visible parts of the body. Persons with subclinical infection did not transmit the disease. Vaccine highly effective, easily administered, heat stable and confers long-term protection. International cooperation. Vertically transmitted diseases are hepatitis B, HIV or AIDS, malaria. False answer: hepatitis E, gonorrhea. Post-exposure vaccines are used in rabies, hepatitis B, tetanus. False answer: pertussis, tuberculosis. Indication for post-exposure prophylaxis with immunoglobulins: hepatitis A, unvaccinated contacts, measles, if exposed child has heart or lung disease, human specific immunoglobulin, hepatitis B, sexual partner inoculation injury, infants born to infected mothers, tetanus, high risk wounds or when immunization status is incomplete or unknown, rabies, chickenpox, immunosuppressed children and adults, pregnant women. Active immunization is preferred if contact is with a patient who is within 1 week of onset of jaundice. Commonly used post-exposure prophylaxis: rabies, hepatitis A virus, B virus, C virus, HIV, tetanus. Post-exposure prophylaxis by vaccine: rabies, hepatitis A virus, B virus, tetanus. Example of zoonotic diseases in Bangladesh: true answer anthrax, rabies, kala-jar, hydatiid disease. False answer dengue. Zoonotic diseases include: true answer rabies, plague. True answer rabies, plague. False answer epidemic typhus, salmonellosis, giardiasis. Disease transmitted vertically are: true answer AIDS, hepatitis A, hepatitis B, AIDS, hepatitis B, Toxoplasma gondii. Disease transmitted vertically are: true answer AIDS, hepatitis B, Toxoplasma gondii. False answer tuberculosis, measles. The portal of entry for the tetanus pathogen are: true answer excoriated skin, open wound. False answer oral mucosa, conjunctiva, gastrointestinal tract. The HIV virus is synergistic with Epstein-Barr virus, cytomegalovirus, herpes virus, papilloma virus, Mycobacterium tuberculosis. HIV is not